Welcome back to my YouTube channel. In this video, I am going to help you increase your critical thinking skills by reading over a scenario and informing you of how I would be thinking as a registered nurse. I think that this would be a really good video for students who are taking med-surg. So let's get right into it. The report reads, the nurse takes report at the start of shift. 85-year-old Caucasian female presented to the ER, status post-fall at home. Patient complaint of hip pain. Past medical history is osteoarthritis, hypertension, heart attack, diabetes, and a left mastectomy. ER nurse reported the vital signs as follows. So just looking at this is a report from another unit in real life. A lot of times you do not get a report from an ER nurse when they bring a patient up to med-surg. It's just been that way. As I'm looking at this, I consider everything that I read. I go back and I point out that, hey, she's 85 years old. So she may be frail or she might be walking better than me, who knows? She's a Caucasian female presented to the ER, status post-fall. So she had a fall and she's 85 years old. It says she had a fall at home. So I'm just kind of wondering, where was she when she fell? Did she fall when she was out in the garden? Did she fall when she was getting out the shower where it was wet? Or did she just fall? Because if she was cooking and all of a sudden just fell, then that could mean that something else is really going on. So I continue to read. The patient complains of hip pain. Okay, so she fell, she must have landed on her hip, but I need more information. So you can kind of pretend as if you are assessing the patient. And something that I notice when I do teach simulation is that a lot of students do when they assess, but they fail to ask. A large part of assessment is asking questions. So if this is your patient, you may ask, which hip hurts? Is it right or is it left? How does it feel? Is it aching, stabbing, throbbing, burning? Also, I will want to look at her hip and make sure that there aren't any bruises or broken skin or anything there. I will ask her if the pain radiates. Does it move anywhere? I will ask her, have you taken anything for the pain? So it says she fell at home, but it wasn't reported to us that she took something for the pain before she came. Actually, it's not even reported to us that she received anything in the ER. So I'm just kind of in the dark here. But the pain, we want to know if she took anything for the pain. Does anything make the pain feel better? Has anything made it feel worse since she's fallen? Also, we are looking at, is it constant? I mean, is her hip hurting all the time, or does the pain come and go? We need all of this information before we call the doctor. So if the doctor is going to prescribe her a pain pill, he will prescribe her something that will help based off our excellent assessment. Now we look at her past medical history. So when you are looking at diseases that a patient has in a question, especially if there's more than one, you are thinking back to what you have learned about all of those diseases. What are the signs and symptoms? What do they cause? Osteoarthritis, we know, is a breakdown of cartilage in between the bones. It's bones rubbing against bones. It doesn't get better. It actually gets worse as you age. And it can cause inflammation, a decreased range of motion in the joints. It can cause pain. She could have fallen simply because she had osteoarthritis. Hypertension, so she has high blood pressure. I see in the report that her blood pressure is 157/88. Now, it wasn't given to me in report that she received any type of medicine while she was in the ER. I need to ask my patient, do you take blood pressure medication? And if so, when was the last time that you took it? But why else might her blood pressure be high? And this is actually a part of fundamentals. Her blood pressure might be high because she's in pain. Whenever a patient has pain, their blood pressure will go up. Her respirations are within normal limits. Temperature's good. Heart rate's 90. O2 sat is 97% on room air. So something else that I'm going to look at just from this little information that I have here, I am going to look at the fact that she is diabetic. Now, this is also another reason why she could have passed out. The nurse did not tell me what her blood sugar was, or even if she took one when the patient was in ER. I may ask my patient, what does your blood sugar normally run? Or do you take insulin? If you take insulin, when's the last time you had it? How much insulin did you have? When's the last time you checked your blood sugar? How about when's the last time that you fell? Do you fall often? So diabetes could be a factor here. Maybe her blood sugar was too low. Also, she's had a heart attack. So this is quite serious. Sometimes when people fall out, maybe she just fainted. This could be heart related. Do you remember the signs and symptoms of a heart attack? Remember that the signs and symptoms of a heart attack are different in women. They usually consist of more of GI issues. They can have a heart attack without even having chest pains. So it's important that you discuss with her the signs and symptoms of a heart attack and make sure that she's not having any. So this is just a very short video. I wanted to make it less than 10 minutes just to show you how I'm thinking with this very little information that I've had, because as a nurse, you're going to have to consider all the information that you have been given on the patient, even the history, so that you can kind of try to tie in what might be going on with the patient. And I hope that this video has been helpful. Don't forget to subscribe, like, and share.